And now for a message from our sponsor, Partnership for America's Healthcare Future. I'd like to introduce Lauren Crawford-Shaver, Executive Director of the Partnership for America's Healthcare Future.
Thank you all for joining today. My name is Lauren Crawford-Shaver, and I'm the Executive Director for the Partnership for America's Healthcare Future. First, a little bit about the partnership. We're an organization that's come together with all assets of healthcare across the community, from hospitals to physicians, to health insurers, to pharmaceutical companies, to patient groups, and to other advocates, looking and focusing on building upon what works in our healthcare and making sure to fix what doesn't. Simply put, we see Medicare, Medicaid, employer-sponsored insurance, the marketplaces, all coming together and to do their own part to strengthen our current system. Today's conversation is going to be one that focuses on our 5 tenets of things that we think are really important in strengthening our healthcare system. That includes expanding access, improving quality, protecting our most vulnerable, strengthening employer-provided coverage, and preserving control. With me today, I am joined by Philip Morris, partner at Locust Street Group, and also the exclusive pollster for the Partnership for America's Healthcare Future. We also have Jeremy Nagosian from FTI Consulting, one of our research partners who has continuously helped us analyze real important questions that look at access and cost questions when it comes to healthcare. I'll open it up to Phil over at Locust Street, who does a lot of our polling. Why do you think the favorability ratings of our current system are at record highs right now?
Well, Lauren, I think there's really a few factors at play when we think about why we see such high levels of favorability. First and foremost, employer-provided coverage and private coverage through the exchanges enjoy broad support by those enrolled in them. In our most recent Voter Vitals survey of 2,000 likely voters nationwide, 75% of folks with employer-provided coverage or who purchase coverage through the exchanges are satisfied with their coverage. As we try to understand what's driving that favorability, I think there's really 2 primary factors: affordability and choice when it comes to coverage. Thanks to competition among insurers, expanded subsidies to purchase coverage, Americans have access to a wide array of coverage options to choose the one that's best for them and their family. All of our polling is clear that voters want choice and control over their coverage, not a one-size-fits-all system.
Jeremy, a question for you. Some of the research you've done for us has looked at ways to enhance our current healthcare system and increase coverage while lowering costs. Can you provide some more details and some findings from your research?
Of course. So we've looked at a number of policies that have been discussed across the country that are intended to improve the healthcare system in the U.S. We've found that just enhancing subsidies or taking the system we have today, the exchanges, and trying to focus on the people who don't already have insurance by just increasing the amount of subsidies being provided, we can increase coverage by over 1 million people. In addition to that, expanding Medicaid for the states that haven't already done so, that could insure an additional 1.5 million people. So all told, combined, those 2 changes could increase the number of insured Americans by over 2.5 million people. So looking at that and comparing that to enhancing subsidies or expanding Medicaid, we found that the public option, while it would increase coverage, it wouldn't add the numbers of insured that the other 2 would add. So we found that in comparison to enhancing the subsidies and expanding Medicaid, a new public option would increase coverage by less than 2 million people. And one of the issues with the public option is this would require an entirely new system to be set up, which could also lead to reduced access for Americans that already have coverage.
Thank you very much. So I want to go ahead and turn it over to Phil for a second. What are some of the clearest wins, if I dare quote there, in healthcare over the past decade that have increased voter support for our current healthcare system?
Well, I love that you put wins in air quotes there. We obviously can't make everyone happy, but I do think that from our polling, there are 2 clear wins in terms of the vast majority of folks really supporting and rallying behind these and feeling that the industry has delivered in a big way. And I think the first of those was certainly the passage of the Affordable Care Act, which did a few critical things. It guaranteed coverage for pre-existing conditions, its most popular provision by far. It created the marketplaces that gave consumers more choice and more options for coverage. And it expanded Medicaid eligibility, as Jeremy was talking a little bit about before. And I think all of this increased access to affordable coverage for millions of Americans, and importantly, did not threaten private coverage that we know millions of Americans enjoyed before and continue to rely on today. I think the second in terms of wins was really the COVID-19 pandemic. Obviously, this pandemic was a once in a century event that required a coordinated government and private sector response. And I think our polling is clear that voters perceive the healthcare industry as being highly effective in addressing the pandemic. And so what it really boils down to is you have a scenario in which the federal government worked together with the industry in quickly adopting a number of other measures. And I think this was a prime example of private plans, public programs, and the industry as a whole working together to meet the needs of Americans during a really critical time. And I think that's exactly what we see voters are looking for in all of our polling.
That's interesting. Thank you, Phil. And I get, you're right. These are two, well, we should call them pivotal points, not necessarily wins, where we've built on and continue to test our healthcare system. Thank you. All right, Jeremy, here's the question that I think everyone who does economic research on healthcare gets. We know that voters are concerned about healthcare costs. What kind of savings are we looking for Americans if we keep building upon our current healthcare system with enhancements like those you looked at in your research?
Yeah, well, I've talked a lot about how these enhancements might increase the coverage rate, but the other effect they're going to have is on the people who already have health insurance, it's going to lower their premiums. So we found that the enhanced subsidies, and this depends on what level of income a person falls under, but the reductions in their net premiums could be higher than 25%. And in dollar figures, that's more than $150 per month. So it could have substantial savings for people who are currently insured.
Excellent. Thank you for that. All right, Phil. Some polls claim that the government healthcare or single payer are increasingly popular. Your polling and what you've shared with Voter Vitals here does not say that. Why is there such a discrepancy between what you're saying and what you're seeing and what you test versus what other groups are pushing out?
So I think this is a really important question because the way polls ask these questions makes a world of difference in the results that they achieve. It's critical that any description of single payer is clear and unbiased to avoid skewing the results one way or another. And I think if you look at every single poll that shows high levels of support for Medicare for all or for single payer, they do not at all make clear that it would replace or eliminate private health coverage. They also don't mention that it would be funded by taxes. And when it is made clear to voters at a minimum that it would replace private health insurance, support is very limited for these proposals. A majority, in fact, do not support them. And the more that voters learn about these proposals, the lower their levels of support.
And I think one important point, Phil, is that most Americans agree that we do have a desire to make sure everyone does get coverage. They do not oppose that, but there's just different paths to making sure that happens or making that a reality for everyone. And that's really what's at stake in the question here.
Yeah, I think that's exactly right, Lauren. The end goal, there are a few areas of bipartisan agreement these days, but there is bipartisan agreement on the end goal being increasing access to coverage for every single American, and not just any coverage, but coverage that's affordable and high quality. And where we see this debate is just over how do we achieve that. And what's remarkable is there's even consensus still among Americans around how we should do that. And that's building on what we have today to expand or increase access to coverage and care. What a majority of voters are looking for is not to create something brand new. It's not to start from scratch. And it's certainly not to move to a government-controlled system.
Thank you, Phil. All right, Jeremy, I have one more question for you, and then I think we're nearing our end of time here. When we think about the future of healthcare, is it fair to say there will always be a push and pull around access and costs? I know that's been a lot of the research you've done with us. If it's not those two, what else is it going to be about?
Well, I'd hesitate to say there will always be a push and pull, but I think for the time being and for the foreseeable future, there's definitely going to be this push and pull. A lot of the plans, especially like the public option or even Medicare for all, the way that they're designed to increase coverage for Americans and save costs is simply by reducing the amount of money they're paying providers. And that reduction can have unforeseen consequences on access to those providers. So some providers may be able to reduce their costs and possibly at the expense of quality of care. But other providers are already on the edge of bankruptcy, and any reduction in payments to them could cause them to go bankrupt.
Thank you. Well, I really appreciate your time today. I'm glad we've had this conversation. There is certainly so much still happening in healthcare now, will continue to be happening. I think to the important point at the beginning, people like our current system. It's not perfect. There's definitely room for improvement. And as we look at those improvements and we consider those plans, we have to ask ourselves a really important question. What is this proposal and what is this plan trying to solve for? And what are the potential unintended consequences? And then we need to actually weigh in and view what those plans are. So I know this is many conversations in the future that we're going to be having as it relates to this. And I look forward to working with you, Jeremy, and Philip in doing that. Thank you all for joining.
Thank you, Lauren, Philip, and Jeremy. I like that line, increasing access to coverage that is high quality and affordable is pretty much a North Star for people, no matter where they are in this healthcare debate. So just a question of how you do it.